Hello, everybody. Thank you so much for being here with us today for our virtual town hall on our health. I'm Dr. Cindy Banyai, candidate for Congress in Florida's Congressional District 19. I'm a mom and small business owner, and I care about our water, our health, and our community. And that's why we're here today. We are here talking about our health. So thank you so much for being here with us. And for those of you who are watching later on, please feel free, if you're joining us during the live session, to put your questions or anything that you have comments on into our question box. And my team here will be sharing that information with me so that I can answer your questions or we can think together about solutions. So without further ado, I just want to say thank you for joining and for being part of this new virtual world that we're all thrust into, some less, prepared than others, but I'm glad that you're here and I'm glad that we still have some ability to connect and learn together. So if you are also thinking about us and you're here during our live session or watching afterwards, you can also check me out. More information about me, you can get there to my website through cindy4swfl.com. You can also email me directly any questions or comments you may have at vote@cindybanyai.com. You can go ahead and give me a call or a text, 239-351-5574. I'll be listening and waiting to hear from you. So, our health. It's one of the big things that I talk about on a regular basis when I am with people in our community. I decided that despite, by the way, recommendations from various political strategists and folks around town just saying, oh, healthcare is so complicated, we don't want to talk about it. I decided to make it one of my major issues because it's important. I learned that it was important not only for everything that we do in our life. But if you don't have your health, you don't have the ability to keep your job. And if you don't have the ability to keep your job, you can't take care of your family. You can't take care of your family. There's a whole heck of a lot of other issues that you come along with that. So I have determined that access to affordable healthcare is one of the main things that I am fighting for Southwest Florida and for everybody in the United States overall. This is not only because I think it's so important in terms of all of the components of our economy and our lives, but because of my personal experience with the system as well. For those of you who have not heard it previously, my youngest daughter, who is inevitably going to bound in here at any moment because I'm home with all three of my children, but my youngest daughter, Evie, who just turned 3 in January, spent the first 2 years of her life in and out of the hospital fighting a rare blood disease. So that blood disease left her massively incapacitated very quickly too. It came on, we initially just first thought she had a cold, and I scheduled the sick baby visit at the pediatrician's office. We went to the pediatrician's office and we left in an ambulance. My first call in the ambulance was not to my mom, not to my husband, but to the insurance company. That was because I was so afraid of going bankrupt from medical bankruptcy. I wasn't sure what was wrong with my daughter, and I wasn't sure how much it was going to cost to keep her alive, but I know that a trip in an ambulance is not cheap. I know that a trip to the ER is not cheap. I know that a stay in an ICU is not cheap. And I was worried for myself and my other 2 children that this was going to bankrupt us. So I made sure, and we had a plan. There was actually a problem with my plan that we were able to solve in the ambulance on the way to the hospital. So I was very fortunate for that circumstance that we did have a place plan, that I was able to buy that because as a small business owner, I didn't really have many other options. I didn't have options through my job at the university, and it just was, I was very limited in that. And without the Obamacare and marketplace plans, we wouldn't have had coverage. So that being said, we spent the first, like I said, 2 years of her life helping her through this rare blood disease. And all the while, we were fighting the insurance company, right? So not only was it just that first day in the ambulance, but every time since then. So we had had, she had to have blood work every week. That's how fast moving her blood disease was. Every week we were in hematology oncology at Townhall Children's Hospital here in Southwest Florida, and we were getting blood work done. And her doctors needed that to know whether or not she needed a transfusion that day. Okay, that's how fast moving it was. But the insurance company said, oh, no, you're at a hospital facility. We only support and we only cover blood work that's at our preferred third-party testing location. And I went round and round and round with them. And ultimately they said, well, you're just going to have to pay for this out of pocket. Despite the fact that the doctors needed it, despite the fact that her blood disease was so fast moving, we had to pay weekly out of pocket $250 to get the blood work that she needed to know, that the doctor needed to know whether or not she needed a transfusion or some other treatment. And again, round and round and round, and it was like, oh, it's a code 11 instead of a code 4. And I'm like, listen, my baby is deadly ill. Can you just cover this? Because I bought a platinum plan. I could not have bought a better plan. Okay. And I still had to fight with the insurance company. I was still paying a ridiculous amount out of pocket to cover these costs. And it's crazy that somebody who has a child with a life-threatening illness has to do this just to get the coverage that they thought they bought in the first place. Okay. So round and round and round we went, again, fighting the insurance companies every single time. She had chemotherapy that destroyed her immune system. That actually ended up with her going into the hospital in the ICU for 25 days. That was $1 million trip. Okay. If you look at what the bills that they sent to the insurance company, the ICU, the breathing treatment, the intubation, the sedation, when she had to have a second ambulance trip, then she had to have EEGs because she had seizures. She had to have spinal taps. She had 2 spinal taps, okay? Around the clock care in the pediatric intensive care unit, $1 million. That's what they had charged to the insurance company. Now, the questions that I always think about is, what if we didn't have insurance at that point in time? Would she even be alive today if she didn't have insurance? I don't know, because would the hospital would they have gone through all of those treatments? Would they have done the extra diagnostics to determine that, yes, in fact, she actually had pneumocystis, even though it would be very weird for an infant to have this lung disease that was killing AIDS patients before people knew what AIDS was? They couldn't believe it, but that's actually what was going on. And they had to fight internally, like, to get the test to determine that that was what she had, that she had pneumocystis. Now, would they have went that far if we were on Medicaid or if we were uninsured at all? I'm not so sure. And this is not to say that I'm criticizing the practitioners at Townhall Children's Hospital. It's absolutely not. They were fantastic. They went above and beyond, and I think they would every single time. Unfortunately, like every other hospital system in the United States, I know that they function and they make decisions every day based on coverage, on whether or not that particular insurance company is going to cover it, whether or not the Medicaid or Medicare is going to pay them back enough to recoup the cost for it. These are decisions that they make from a practical standpoint. And doctors all the time are determining, okay, well, this is kind of a nice to have and this is a need to have. And you know, in any given ICU unit, you don't know necessarily what is a nice to have or the need to have.
Can I take a bath?
No, not right now. Here she comes here. Oh, go wash your hands. She had spaghetti for lunch. She's covered in spaghetti. So thankfully she's fine now through all the trials and tribulations. But, and there's more, you know, so once we actually got that, go to the kids' bathroom. Go to the kids' bathroom and wash your hands. Once we got through the really, you know, significantly life-threatening part, and she was in this routine treatment, and we had moved from a marketplace plan to that coveted employer-based plan, right? That thing that we're all supposed to dream about and make sure it's included in our employment package, because yeah, everybody gets that option. And I'll tell you what, myself as a sole proprietor business owner and a part-time faculty at the university, and then my husband who was part of a small legal firm, there was no such thing as an employer-based plan for us. He then moved to an organization that had a very modest employer-based plan. And guess what happened then? They denied her treatments. Yeah, same treatments, same hospital, same child, same doctor, same diagnosis, same treatments, same insurance company, different policy, denied. To the tune of $3,000 a time. Now we had to go through and go back and forth and get the caseworker and get the paperwork and then redo the paperwork and then send the paperwork over here. And then we had to give it an appeal and on, hours and hours and hours of my life to get her the same treatment that she had been getting at the same hospital, the same doctors, the same condition. So, like I said, if you didn't hear her, you didn't see her, you saw her bounding in here after eating a spaghetti lunch, happy and healthy at this point in time. And for that, we are grateful. And we just got the news before Thanksgiving of last year that she was totally clear of the blood disease at this point and her immune problems. And all her numbers came back good enough to stop treatment. And we're very, very thankful. And if you saw her, you would have no idea that she went through all of this. You would know by how tough she is and how she doesn't care about anything, but you wouldn't know all of these things. And but that's why I think that fighting for health insurance and affordable access to care for everybody is so incredibly important, because you don't know when you're going to need it. That's the point of insurance, right? Like, you don't know when you're going to have it. You have it for when it's an emergency, right? It's kind of like prevention overall, right? Like you try to prevent things and your barometer of success is if it doesn't happen. And then when things happen, you know that your prevention failed, okay? Insurance is similar, right? So insurance, we have it in case we need it, in case there's an accident, in case there is a disease that comes up. No, there was no way to predict that my infant daughter was going to have a rare blood disease that occurs in less than, 1 in 500,000 kids in the world, right? Like, there was no way for us to predict that. And, but she deserves to live, just like everybody else accessing our health care system. And to think that if we didn't have that Obamacare plan, she may not have lived. And that would have been a choice in the healthcare system. And that is a choice that people make every single day, whether or not they get this treatment. And it's not right. It's not right. We shouldn't be forcing parents of sick kids into spending time that they need to preciously be taking care of those kids, or also taking care of their family, or also trying to keep their career going so they can have the income to take care of that family, instead of forcing them to spend hours and hours and hours and stress in their life fighting an insurance company who doesn't want to pay. Because it's not about people, it's about profit. It's about making money. It's about salary for big time CEOs. Because frankly, our insurance company is a nonprofit, but they still make a ton of money. Their high-level CEO, their C-suites, millions of dollars a year. Their low-level staff, no, not as much. Their high-end staff, they make a lot of money. And they get to make that money by causing a lot of heartache and pain for families like mine, and probably families like yours too. And this is why I fight. This is why I'm fighting for our health, because we shouldn't. We should absolutely not have this system. And there's another way. There is another way. There's lots of other ways, actually. We are the only country, the only developed country in the world that doesn't have a robust medical system that provides affordable access to care to everyone. And I just cannot believe that we have been taken over by such special interests that we are no longer serving the public good here in the United States. We are no longer serving the people and giving them the right to life when we have the technology and capacity to be able to do so. So I see that we have a question coming in. Eddie, if you wouldn't mind taking a look at that, I'm going to unmute you, and if you can give me that question, I would love to hear it. As I will also, Eddie, you are self-muted, so I can't hear you. Just saying.
Sorry, can you hear me now?
I can hear you now.
Mommy,
Okay.
so, I want another Mickey.
Go ask JT to put it on for you, and go wash your face. She's got spaghetti. Okay, thank you, Eddie.
Sorry, I've been having computer technical difficulties. So do you have a specific plan for some kind of legislation that would address the kind of problems you experienced?
Yeah, absolutely. So what I talk about a lot is making sure that we are designing our healthcare system based on models where there has been success. Where you have the baby kitty. Can you put the kitty down?
Okay.
Thank you. So I actually spent several years, I spent 5 years in Japan. Japan has a nationalized health insurance system that is decentralized in their implementation. And that means that the structure is provided for by the national government, but then it's actually administered by the municipalities around Japan. They have some of the best health outcomes in the world. They live longer than anybody else, and they have low rates of cancer, heart disease, things like that. Now, people always say Japan's a different country, they have culture differences, they have lifestyle differences, and those things are true. However, if you examine how they implement and design their healthcare system, you will see a couple of major differences that we could absolutely adopt in the United States. First, there's an emphasis on prevention and preventative care. So there is no kind of piecemeal, coverage issues with diagnostics and preventative diagnostics, right? So every year you get a full workup of your blood, your lungs, your spine, your heart, and a lot of other blood work to kind of determine other components, making sure your major organs are working, your liver, things like that. And the doctors are monitoring that year over year. And there's a centralized database to make sure that there's kind of a tracking around that. These are things that were components of Obamacare, but have not been fully implemented as well overall. We got the let's get a physical there, and actually, if you remember, the centralized data management system was a component of it. But again, it wasn't, it could still be improved upon. But those are things that we need to have more robust prevention and testing services. The other components of it, the basic meat of it, is that it is a national health care system that every single person can buy into, and it is on a sliding scale based on their availability to pay. So as a student in Japan, I was paying $25 a month for access to care, whereas somebody who had a salary job was paying about $300 a month, okay? Now this is makes it, equitable for everybody. The other components of it that are similar in nature, for instance, in the United States to the way that Medicaid works, is that there's cost controls from the top down. So there is, based on market value, based on affordability, okay, as well. That's a component of the calculation. The Japanese national government sets up tables of costs for all procedures. And that's the top amount that any individual organization that provides healthcare services across the country, that's the top rate that they can charge people. And from MRI down. And we do that with Medicaid and Medicare. Now our market around it gets very complicated because we have multitudes of competing factors. The way that we set the costs for Medicaid and Medicare are not necessarily indicative of the way that they can get money for it in the market. So this creates an incentive where we have the private health insurance companies and the hospitals upping the price that they charge the insurance companies. And by the way, those are all secret negotiations, if you didn't know, right? So there's no availability to understand what the hospital is charging Blue Cross Blue Shield versus United Healthcare. That's private information that they don't share with anybody. So you could be paying Blue Cross, their cost for a procedure is $1,000, and it could be $200 for United Healthcare, and it could be $150 in Medicaid. And but this creates a very, very like gross incentive system across the board for hospitals to recoup costs by getting, making sure that people who have this insurance company are getting these procedures, and this insurance company get this one, or we can't get this one on Medicaid because it's too expensive. But if it's centralized, you say this is the cost period, this is what you can charge for it, and have some caps on those things, then it equalizes it. So that means that people who, treatment is then doled out based on what is needed, not what ultimately the cost to the institution is. So those are a couple of the things that I propose in the reform of our healthcare system, is looking at prioritizing prevention, cost controlling from the top down, and making sure that everybody has access to that nationalized health insurance program. Now, does that mean that it's the same or different than Medicare for all? Is it the same or different than Obamacare? I would say it's kind of a mix of all of those things. There are components in Obamacare that I think that we need to recognize are important and continue to move forward and reform it. There are problems in Medicaid, and so the Medicare, Medicaid for all kind of plans need to be reformed as well. There's also the concept of how we roll it out. I do agree that there needs to be a timeline for rolling it out. It can't just be like tomorrow we're going to national health care. It has to be over a period of time. We also have to think specifically about the role that the insurance company may or may not play, right? In Japan, there is still a private health insurance market, but it works more on a supplementary. And so sometimes some employers will offer like a gap plan, somewhat similar to what do we call the Medicare Part D, or like AFLAC in a non-health related area. But it's like, okay, so you don't want to pay, or we want to give you a benefit for working for our company. So here's this supplementary health insurance that's going to pay for your monthly premium, as well as pay for any of that cost that would be remainder to you outside of the fixed cost. Now that for me seems like a very reasonable transition that some of these private health insurance companies could make in the United States, but we could still design a system that ultimately keeps public health in mind, that keeps, the right to life, the right to care in mind, as well as make sure that people are not going bankrupt, because that's, I think, what it's just a thing in our country. Oh yeah, of course, you just declare bankruptcy, no big deal, wiped away. I've even had like discussions with people in my network that say, oh, well, you should just declare medical bankruptcy, and this is part of the process. And I think for me, that's like a very disgusting concept in terms of how our healthcare system is implemented. So Eddie, I see another question's coming up there. Can you help me out with that?
Yes. Sorry, more technical difficulties. Question. Instead of referring to it as Obamacare, maybe refer to it with the legal name, formal name, the Affordable Care Act, because people do stop listening when they hear Obamacare. I mean, personally, I've even seen the segments online where it is, they'll go out asking people in a Trump rally line, oh, do you support the Affordable Care Act? Oh yeah, that sounds great. Well, what about Obamacare? No, we don't need Obamacare. It's like, okay, well, did you know it's the same thing? No.
Yeah, no, listen, I know. I've seen those studies. It's amazing to me. But here's the thing about this, and I'll just talk about this a little bit, is that one of the things that us as politicians, as leaders, as candidates, what we're trying to do is we're trying to drive dialogue, right? So, me, and actually Eddie, for those of you that know, is one of my former students at Florida Gulf Coast University. I can get really wonky on all this kind of stuff. Like I've actually, edited book chapters on comparative healthcare systems between the United States and Japan. This is one of the reasons why I'm very well versed in it. However, you can't talk that kind of detailed politics all the time. what we do get is kind of an outsized megaphone to talk about our issues, right? And so for me, you see that I purposely go back between saying Obamacare and the ACA or the Affordable Care Act, because when I tell my story about essentially how Obamacare saved my daughter's life, I think it's important for people to recognize that it was Obamacare, and even if that puts them back, and listen, I can't tell you how many drag down fights in my own family I've had about this, okay? People who love me and my kids, my parents, my cousins, my aunts, my uncles, but they're so programmed to think, like you said, Obama is bad, that they're trashing on the Obamacare. They trash on Obamacare. And oftentimes, by the way, what they're trashing on is the mandate and the cost. But here's the thing that they don't often realize or connect the dots on, is that the mandate was the Republican component to the original ACA, okay? There was a demand from the insurance companies, and then they turn around and they trash it anyway, okay? So that's what kills me about that, is that that was their buy-in, because that's all about pooled risk, okay? They needed all the healthy people to buy insurance to pool the risk to bring the cost down. So they pressured the Republican congressional representatives and senators to make sure that that component got stuck into the ACA, to make sure that everybody bought it so that they don't lose money. My mom used to work for Blue Cross Blue Shield too, okay? So like she explained this whole pooled risk thing to me, particularly in terms of how it works with Obamacare, okay? So that's what people got mad about, in their lives, right? Most people push back on things, on how it affects them in their life. So the individual people, if they do not, for instance, have a chronic health care condition they need to take care of, or they don't have a family member that suddenly gets an accident or a rare disease and needs Obamacare, if they're just a regular, relatively healthy person, and they're getting their taxes raised because they can't buy a marketplace plan, that's going to make them mad, right? And then people who don't want Obamacare are going to spend that. The other major complaint that I've heard, and literally just a couple of weeks ago, was arguing with my aunt, who's a nurse, okay, about this, is that it's out of cost for most people, right? I bought a marketplace plan, Obamacare plan, okay, for my family, platinum, the best one you could buy, $3,000 out of pocket per month for premiums. Now, I made that choice because my husband had just lost his sight and had a heart condition, so we needed that coverage for him. And I had kids. I'm like, okay, we need the kids. I want them to have that stuff. I had no idea at the time that I purchased that plan that it was we're going to need it for Evie. Okay. But that is so far beyond what most people can pay. And it was like pushing the edges of what I could pay. I mean, that was more than 50% of our total family income, right? Like it was a lot of money. But if you don't have health, you don't have much. And we already had all these issues. But even the most affordable plans, and this is again where the profit motive within the health insurance companies really perverts everything. Because the reason that the least expensive plans in the Obamacare marketplaces, right, are still so far out of whack or out of affordability for most people is because they were forced to cover things that they usually don't. So it used to be, and now they've let some of these plans creep back in, but it used to be you couldn't buy a garbage plan that, yeah, when you showed up to the ER, it didn't cover 75% of what you needed. They used to not do that. Or they used to not let you do that. But it used to be possible for an insurance company to give you a garbage plan. I know you found a light. Do you want to come say hi? Okay. But that's the problem, right? Is that there's this continued profit motive in there. And this is why too, when my piece that I add to the dialogue, because there's a lot of components and a lot of the people, you know, especially our Democratic presidential nominees or candidates, what they were talking about, there's a lot of components of it that I agree with. But ultimately, unless we get the cost component taken care of, we're never going to get out of this kind of Mobius strip of people being able to pick apart the ACA, Obamacare, because it's never going to not personally be so expensive for them. We have to take that profit motive out of it. And I think that one way that we can do it is through cost controlling from the central government, national government. I see another question coming in.
Yes.
Patty, can you help me out?
Someone is asking, actually, Jill is asking, when you're talking healthcare, do you plan on addressing supporting a woman's right to choose in your healthcare plan?
Yeah, absolutely. In every piece of policy and ideas that I write down, I put that we need to have access to all care for every person in every circumstance that they need, as well as making sure that we're ensuring privacy and freedom for individuals. And this is where the women's right to choose really comes in, particularly in the state of Florida. It actually constitutionally within the state of Florida, we're protected to have and continue to have access to all women's reproductive healthcare services, because it ultimately comes down to privacy. And we don't have to let anybody outside of between you and your doctor determine what procedures you need. And I am working towards getting an endorsement from a Planned Parenthood Federation of America, as well as NARAL, because I think it's really important for us to maintain body autonomy for women and to make sure that we're not using other backdoor policy methods to curtail that, right? And we see that in a lot of different ways, particularly at the state level, which is now where people who are fighting against women's right to choose have taken the battle. They're trying to pick apart small things. We saw at this legislative session here in Florida. Oh, yeah, because you put play in front of it. Go ahead and go on out, okay? I'll fix it later. This legislative session, they used the whole concept of being a minor, right? To say, oh, of course, like a minor would need a parental, okay in order to get an abortion. And in this like perfect world where every minor that happens to have this is just like an irresponsible teen who just didn't know what was going on and doesn't want the burden, and they can just go, mommy, please, I need this, and they get the signature, right? But as we know, and those of us who have worked in healthcare, who have worked in any sort of social services, know that a significant portion of the people, of the women who are seeking abortions and other reproductive health care, particularly who are minors, they are not in a position where they're going to be able to get parental consent for anything, because they are either being taken advantage of or abused by somebody that's close to them within their family, right? And there's denial at best, being complicit at worst in these circumstances. And here's the situation. If they really did want them to get an abortion, they would be rolling them right in there. But if they don't want to participate in that, they're not going to. So you're at risk of allowing another generation to come in. You're ruining a life of a young woman who's already had so much trauma, right? And now having to take care of another life, it kind of just ends up spinning the cycle around. And it's sad when legislators are making decisions that are not based in reality, that are based in their kind of like fantasy world of where they want. Because, I'll tell you what, I've had a lot of conversations with people who are your pro-life folks, right? And they're like, oh, babies are precious. I'm like, yes, absolutely. I'm a mom of 3. Babies are precious. But that's me, right? Like, I love my kids. I've worked in, homeless services, and I've dealt with the child welfare system enough to know not everybody functions like that. And you can't just kind of have this and, fantasy view of the world and make policies based on fantasy, right? I would love to see everybody thinks that their child is a blessing, but that's just not how it works. And we need to make policy that's related to how people actually work. Well, you probably chase the kitties away.
Where are them?
Even spaghetti face little munchkins like this. Okay, go on out then. All right, Eddie, do we have any other questions? Because clearly I can just kind of keep going on and on on my own soapbox, but part of the reason why we're having these town halls is so we can people and hear from you. Does anybody had any of these, stories in our healthcare system? I would love to hear from them, hear from you about that. I will say too, I wanted to focus this on our health overall, but of course we're in the middle of a pandemic right now, right? So we need to, we're seeing a lot of these lapses coming at us right now with what's going on around our country. We heard stories out in California of a young man who didn't have health care. He was turned away at the hospital and later died of the coronavirus. How many people right now in our own community don't have health care, who have no idea how to navigate this complex system that we've created, and don't, they're scared to go to the hospital to try to get a test that may or may not be available to them, to take care of themselves. I have personal friends right now who I've had this conversation with this week, right? They don't have insurance. They are sick. They are worried about spreading it to people, particularly the other vulnerable people and their family. They don't have health insurance. And so they don't know where to go or what to do. And that's bad for that person, but that's also bad for our overall public health. If they do not have the ability to, navigate our system to get the testing, to get the care they need to stop the spread of a deadly virus like we're seeing right now. I will also talk a little bit about why I think healthcare and affordable access to healthcare for all and cost setting and streamlining our system is so important in the context of a pandemic, because you can look very specifically at countries around the world that do have a streamlined healthcare system and how people are accessing their care. People have looked at Taiwan as being, a good example of how to handle a pandemic. I will tell you, they've done this before. I was there, okay? I lived in Taiwan in 2003 during SARS. We've talked a little bit about this, but it was, that was my first experience, kind of what it's like in this lockdown situation. And I was living in Taipei at the time, and Taipei is a city of 12 million people. And just like we saw here, to go dark like overnight, schools closing, it was amazing. And we're seeing it here. This is not my first rodeo with this, I guess is what I'm saying. But there was so many differences in approach to Taiwan and what I'm seeing in the United States right now. So let me tell you about a few of them. First of all, in the weeks leading up to people in Taiwan becoming aware that SARS was spreading, there was public messaging around public health and safety top to bottom. They increased things like sanitation and disinfection in every single place, private businesses, as well as things like public transportation and schools. So I was a kindergarten teacher at the time, and we started, massive cleaning operations every single night, cleaning every single thing in the school, disinfectants, disinfecting toilets, and the walls and the doors. We had also, several weeks, by the way, before we did the suppression stuff like we're doing now, we started taking temperatures of everybody, almost everywhere, okay? Every day, lining up at school. We had the head thermometers, every single kid. And if you were over 99, you were going back home, okay? And they also implemented it at the airports and they're still there, by the way. You know, the body sensors where it was like, okay, it's you're hot, and you know, the health ministry would take you and give you diagnostics to make sure you're not spreading the disease. Also, like public places started implementing some of these temperature scans, restaurants and malls and things like that. And if you were over temperature, they would just basically ask you to go back home, and no, you know, no big deal. And then it's just, okay, go back home. We haven't done any of that here. We didn't do anything at the airports. We haven't done anything in the schools leading up to before they were shutting down. And I'm telling you, this was weeks and weeks and weeks before we shut down the schools and we stopped everything in public. We didn't do any of those preventative measures here. Okay. And I think we're going to see increasingly the consequences of not only just lacking the kind of like public wherewithal, but also the leadership directive to do it. So even before we did the suppression in Taiwan, we had the government, the state officials, the city officials telling everybody, this is serious. Everybody needs to play their part. If you're sick, stay home. And this is what you need to do. You need to clean, you need to take temperatures. They gave people kind of directives to essentially stop the spread right then and there. Okay. So that's one thing that they did that we didn't do, that I'm kind of looking at going, hey, that would have been smart. And they absolutely did it this time around, by the way. The other thing is the access to healthcare. It's a big deal. Taiwan has nationalized healthcare system. Taiwan, though, is totally like, there is no user fees in Taiwan at all. It's like, here, you get your residency card and you get, I think there's like a small amount of prescription fees, but basically, you know, you get access to the hospital, the healthcare systems, and they're everywhere. Everybody feels so comfortable accessing the healthcare system that they do it all the time, right? If you're sick, you go. There's one right down the block. As a kindergarten teacher, I actually had left my class, like my little kiddies went to nap time, and I went to the doctor. I was not feeling well, went to the doctor gave me medication, and I'm like, can I go back to class? Yes, you're fine. Here's medicine, back to class. And that was routine, right? Everybody did this. They would go and they would get the care right when they need it. And it wasn't, you didn't need months out, you know, appointments. You didn't need, in fact, it was so, I'll tell you this, it was so weird for me as an American to like not have an appointment, to like not think about it. I'm like, so I just go, like I just walk into the hospital and I just like they treat me. And you know, for the and this, by the way, happened in Taiwan and Japan. The local people are like, yeah, you just go in and they help you. Like, it's only us in our like convoluted system where we've made all these hoops and administrative barriers for people to get the care that they need, that the simplest of things of like walking into the doctor seems so incredibly foreign to me that I just couldn't comprehend it. Okay. But that's how, you know, people with functioning healthcare systems live. They're like, I'm sick, something's wrong, I'm going to the doctor. And they totally triage everything. It's like you walk in and they're like, oh, you have this problem, this problem, this problem. You see the doctor, you see the nurse, you know, they kind of just shuffle you through this system. And that was true of both the Japanese and the Taiwanese healthcare systems. And then Taiwan, by the end of it, whatever you were diagnosed with, they walked out, they gave you a package of medications out the door. You know, Japan was, you still had to do this other step, but still, it was like bada bing, bada boom, you're out the door. No major compliance, no like, oh, we have to check with the health insurance company. It was like, this is the care you need, this is what you get, and out the door. What that does in terms of your mentality as an individual, particularly during a pandemic, it means that if you think that you're sick and you may have this, you're going to the doctor. And you know what to do. And it's not make 10 phone calls to find the specialist, to get into the right place, to go to the, you know, the right person to get care. It's like I walk to the nearest medical facility and they help me, you know? And again, if you haven't lived in a system that does it, it seems so foreign. And I've had this discussion again with friends and constituents in the area that they just, you cannot possibly begin to understand how simple and helpful to people a national health insurance system, a national healthcare system is, until you've lived in one, and then you see how it can be helpful in times like this. Now, you're always going to have human behavior, right? You're always going to have people saying, it's not me, or I'm not going to go, or not taking care of themselves, right? But the fact that people can access care without major, issues really makes a difference. And we're seeing that in Taiwan's infection rates, right? So not only did they have the kind of preparedness and the public messaging and the leadership to tell people that it was serious, but they had the access to care and the networks so that when it did come time to testing and when it did come time to treating, they were able to do that. They didn't have a bunch of citizenry scared of their own medical professionals and of their own medical bankruptcy, or just, not being able to afford it, period, stopping them from accessing healthcare services. And those are big deals. And that's what I lament in our system. So when I look at how we would kind of retool our system to be better at handling pandemics, it would absolutely be making sure that we have streamlined access to affordable care for everybody. So we can work to make it be like, yes, you can go, you should go, you're sick, go to the doctor, and making it simple for people and not complicated, and these administrative barriers out the window, right? Because those do stop people. That's behavioral economics right there. The harder you make it for somebody to do something, the less likely they are to do it. And that's just the truth. And then that comes down to leadership, right? Which we've seen an incredible lack of, just top to bottom, in the state and the country, dithering. And listen, I'm starting to freak. Florida, we got Marco Island last night opening some of their beaches, and we got a county commissioner here in Lee County talking about opening some parks. We are 4 days into a stay-at-home order. 4 days, okay? And 5 days. Doesn't matter. It's supposed to be 30, okay? And now everybody's just like, oh, it's no big deal. We're just going to open everything up again. Like, what happened to the stay-at-home order? What happened to everybody, taking one and staying in and being healthy? Like, why are we having our local leaders walking back, even the hard-fought stay-at-home order at the state level, where it's like we literally had to get the governor be like, hey, by the way, tens of thousands of people in the state of Florida are going to die if you don't do this. And he was like, oh, okay, I guess we'll do it, right? And we finally did it. And then now, after just a few days, we have local officials talking about open things up like that didn't even happen. So I don't know what is going on, but that leadership, so that's leadership to me, okay? Sticking with what you need to do, telling people the hard truths, and making the right decisions so we can get through this. Because here's the truth, the more that we have this backtracking, the longer it's going to take, the more the economy is going to suffer, and the more people are going to die. So, sorry, there's a bunch of people that want to go to the beach and to the park. But if we stick it out now, we're already here, we can make it all the way to the end. But that takes leadership. That takes more than an email from that same county commissioner when I said, please shut down everything for the life of my child, please. And him going out, golly gee, who, I'm going to be the bad guy here. You can yell at me, but we got to protect our economy. And I'm just like, yeah, I'm going to be mad at you. And trust, I'm going to tell everybody about it. And trust, I'm going to use this megaphone, this platform I have, to make sure everybody knows that you are a terrible leader, Brian Hammond, and your decisions are going to kill people, and we deserve better. We deserve better than a golly gee, we're going to keep the golf courses open. We do, because it's going to hurt more in the long run. All right, I'm off my box now. Any other questions? Any other questions on this or stories to share about the healthcare? And again, you can go to my website. Feel free to submit anything on the website in terms of your thoughts on healthcare. You know, one of the things that is also a challenge about being a candidate and frankly just being a congressional representative is you are one of many, right? So this, you know, there's a desire to tell people what you're going to do and I'm going to get in there and make this big legislation, but you know, I'm a bit more realistic about it too. I know that I'm going to have to work with a coalition of people there to get any healthcare reform across, but I want to make it clear what components I'm bringing to the table. And so not only am I bringing the personal story and experience of a mother with a sick child having to fight the healthcare insurance system, but I also bring the knowledge that it can be different and how we can work components in a nationalized healthcare system that will really benefit people as individuals and in terms of public health crisis like this. So thank you, everybody. I don't see Eddie. Eddie, are there any more questions coming in?
There are not.
Okay. Well, thank you so much for joining us here today, everybody. And for those of you that have been watching this afterwards, I do see one pop up. What do we got?
Yes. Jill's asking, what can we do to help you?
Oh, I love that question. Thanks so much. So I would absolutely love if you would be interested in helping to volunteer. We have some virtual opportunities for things like contribution to social media, blogs, and virtual phone banking. Of course, as a grassroots candidate, I always need help and support to get onto the ballot, as well as to make money to make that happen. So you can check me out. You can go to my website and donate there, or you can go to Act Blue and find me there directly as well. Every little bit matters to me, especially in this next phase that I need to be able to qualify to get onto the ballot. And fingers crossed that my press conference coming up shortly this afternoon, where we're asking for a reduction in fees, goes well. But those kind of contributions, share on social media, all that kind of stuff too helps me. Again, call, email, you got an idea, I'm here to listen. So thank you so much for that question, Jill. Do we have other stuff in there, Eddie?
As of right now, no.
Okay, great. All right, well, we'll sign off then for today. This is going to be recorded and we can share it as well afterwards. You'll find it on my Facebook page and upload it to YouTube shortly as well. Feel free to share it amongst your friends. You'll get a copy of this in your inbox tomorrow as well. So thanks, everybody. Make sure you vote for me coming up August 18th, as of right now. Register to vote, get your vote by mail, because we don't know what the world's going to look like then, but I absolutely need your support. So thanks so much for joining us here today to talk about our health, and we'll see you next time. Bye.